Hey everyone, Trupti Gokani here. Welcome to the Master Your Migraine Pain webinar, 5 steps to resolving your head pain. Let's get started. This is for anyone suffering with cycles of migraine pain. If you want to achieve pain freedom, enhanced energy, harmonious moods, and a deeper connection with yourself and others around you, then this is for you. In the next 45 minutes, we'll discuss how to reduce the severity and the frequency of headaches and reduce the need for quick fix medications. We'll discuss how to understand your unique pain type. Yes, you have one, even if right now you feel lost with why you have pain and why it shows up. We'll discuss how to know for certain what exactly triggers your headache pain so you can be sure to avoid those triggers in day-to-day life. We'll discuss how to have a balanced, sharp, and focused mind versus feeling stressed and overwhelmed with your life and with your pain. We'll discuss how to banish your pain so you can have a deeper relationship with yourself and others rather than trying to hide away and protect yourself in case an attack strikes. And lastly, we'll discuss how to live with less fear of having an attack of pain. My promise to you is a step-by-step plan to resolve your migraine pain for good. So please, friends, stay with me until the end because it's only 45 minutes and it's taken me years, actually decades, to put this powerful information together. And I have something really special to offer for you at the end. So if you can bear with me, I'm going to read through 2 quick disclaimer slides and then we'll get started. The webinar offers health and wellness information and is designed for educational purposes only. You should not rely on this information as a substitute for, nor does it replace professional medical advice, diagnosis, or treatment. If you have any concerns or questions about your health, you should always consult with a physician or other healthcare professional. Do not disregard, avoid, or delay obtaining medical or health-related advice from your healthcare professional because of something you may have seen on this webinar. The use of any information provided by us is made solely at your own risk. Always seek the advice of your healthcare provider with any questions about medical condition or your health prior to starting any supplements, changing lifestyle, dietary habits, or exercise routines. The education and information presented herein is intended for a general audience and does not purport to be nor should be construed as a specific advice tailored to any individual. Any statements or products discussed here on my website or in my book have not been evaluated by the U.S. Food and Drug Administration. The statements and products are not intended to diagnose, treat, or cure, or prevent any disease. I expressly disclaim all liability with respect to actions, taken or not taken, based on any or all of the information presented in this webinar. They are intended for educational and informational purposes only and not intended as a substitute for medical advice. Thank you for listening, my friends. Does this sound like you? Are you struggling with severe cycles of head pain where you are unable to function or even get out of bed due to the pain? Do you feel fatigued and depleted when you wake up in the mornings and even during the day? Do you live your life in fear of the next attack? Have you tried medications for your pain and just given up because they create side effects or barely help your pain? Do you feel like you're dependent on doctors, medications, or even over-the-counter products to control your pain? Are you just sick and tired of these headaches and just want to have some understanding of why you get these and others don't? And lastly, do you feel like your migraine pain is here to stay and there's just nothing you can do about it? If any of this sounds like you, then I actually have some good news because none of those things that we just talked about are the real problem. Okay, friends? Those are just the symptoms. The real problem is that you haven't made what I call the shifts. And we're going to go into these in a few seconds. But for right now, know this. Once you make these shifts, you will realize that it's not that complicated to resolve your pain. You just need to connect with your why, your specific why, and your authentic self, and the rest will follow. Your energy levels will soar as you find yourself sleeping better and waking up more refreshed than ever. Your moods will feel optimal and balanced. Goodbye to the anxiety and fear that plagues you. You'll reduce your need for meds, over-the-counters, injections, and even doctor's visits as the pain improves. You will stop living in fear and begin living in faith that you have control over your pain and an understanding of why it comes on. You will attract better relationships, more love, unique opportunities, and even wealth, as pain prevents you from being your authentic, vibrant self and blocks you from being truly successful in life. So before we get into too much more, let me take a quick minute to introduce myself so that you know who I am and why you should listen to me. So I have been in the migraine space for 15 years with a decade of running my own headache clinic as a board-certified neurologist. I completed advanced training in both Ayurvedic medicine and functional medicine. I've appeared multiple times on national TV as an ancient medicine expert. I'm an author of the book, The Mysterious Mind. I love doing workshops. I'm a keynote speaker. I've been a physician trainer for pharmaceutical companies, actually training doctors how to wisely use medications. My specialty is in helping clients get to the root cause of their pain. That is what I love, and that is my passion. So discovering the 5 shifts. Let me tell you, it is amazing how I really have found these 5 shifts. And it's taken a really long time. Not only have I had my own personal experience with figuring out these 5 shifts, I've worked with many patients over the years to find out what it is they were doing that was really working. And I've slowly shifted kind of more into a coaching role versus being a doctor because I'm using less and less medications. I felt there was more to do and more to offer to those struggling with pain. And, I noticed over time that some people were just improving dramatically as I worked with them, and others kind of got stuck and, stayed the same or they even worsened. And certain individuals had migraines which were severe and frequent, and they were in need of medications, injections, and visits with me. And I felt obliged to understand what exactly those who were excelling were doing and how, we were able to bring them to pain freedom. Which lifestyle recommendations were they following? What supplements were they taking? What dietary changes were they making? What exercise recommendations were they doing? How about the mind work? What was the mind work that they were doing? How about the breath techniques? So I wanted to delve in there. I need to know exactly what those patients were doing versus the others. And what were they doing to get those incredible results? And over time, I'm going to tell you, I realized there were 5 things. There were these 5 shifts that these top achievers were doing, which others either weren't doing consistently or they just weren't doing at all. So I started intentionally incorporating these 5 shifts into my clinical practice. And I'm going to tell you guys, the outcomes were amazing. They were phenomenal. We have hundreds of patients who have been through the process and maintaining their pain freedom for years, even after seeing us in our clinical practice. So there are 5 key shifts you must make, to fully resolve your pain. And I'm going to walk you through each of these 5 shifts. And I'm going to ask you, please pay attention to each shift. Each one is powerful. Stay with me till the end because I promise you're going to learn something amazing with each of these shifts. The first shift, stop focusing on the pain. And I know this sounds challenging. You're thinking, wait a second, I have migraines. How can I stop focusing on my migraine? Well, just work with me here. I don't want you to not at all, be mindful of your pain. I want you to not put all of your focus on your pain. Let's go over some of the current stats. We look at the current, climate of where we are. We're in an opioid crisis right now. 64,000 deaths in 2017. 64,000 deaths. That's 175 deaths per day. And, the thought is that we're losing the same number of people every 3 weeks to opioids as we did, in 9/11. Every 3 weeks, we're losing the same number of people to opiates as we did in 9/11. So this is a really big problem. And I was, when I started practicing, I was there in the day when we started, recommending narcotics for headaches. And I've watched what's happened. And one of the issues was that we focused too much on the acute pain and getting rid of the acute pain. Most people with pain, or those practitioners treating pain, put a lot of focus on the acute pain. The goal over the years has been to reduce the pain to 0, no matter what the cost, right? And a good doctor was a doctor that created pain freedom, right? So if medication 1 was not helpful, what did we do? Well, we added narcotics or steroids or anti-inflammatories to really get people to pain freedom. And that was the mantra. If you're getting people to pain freedom, you're being a good doctor. Well, I was thinking, wasn't the pain happening for a reason? Wasn't there a reason for this pain? And if we just kept on medicating over and over and over, wouldn't this lead to some long-term consequences? Around that time, early in my practice, I read a book by Stephen Covey, The 7 Habits of Highly Effective People, okay? And habit number 2 was begin with the end in mind. Now think about this habit. If you begin what you do today and you think about what you do today and how it influences yourself 3 months, 6 months, a year down the road, beginning with the end in mind is going to really powerfully shift what you're doing at this moment in time. And I realized if I focused just on the pain and medicated, and did all I could to get rid of that acute pain, there could be some issues. And what happened is I started seeing issues arise in my clinical practice. I started seeing that patients were getting rebound. And if you don't know what rebound is when you start to take medicines, it could be anything from an Excedrin migraine to a Vicodin, and you start to get a headache from the medicine. Habituation and tolerance is you start taking the medicine and the medicine stops working. You get used to it. I started seeing that in my practice, and people were needing more and more medications, and their headaches were worsening. I also found that there were secondary side effects that were occurring. Liver issues, digestive issues, ulcers forming. People were having kidney issues from the medicines. And I thought, oh my goodness, I have to begin with the end in mind. I can't give a 25-year-old all these medications because, God forbid, what's going to happen to that person, 3 years down the road if I keep doing this kind of practice. So I started to shift, and I started to learn a new model. And I started working on this concept of strengthening the system in between the attack of pain rather than focusing just on the pain. And what I found is if I focused on the in-between, I strengthened the in-between, working on the time when there weren't in pain, oh my goodness, it's amazing. The actual pain itself started to reduce and decrease over time. And I'll give you one example. I've used lots of different techniques on working on the in-between, and one of the examples is working on your mind. So one example is visualizing pain freedom. So when you're not having pain, taking a moment and just really being grateful for how it feels to be pain-free. Imagine and expand that pain freedom, the emotion of it, how you feel in that state, how vibrant you are, how energetic you are, and expanding that out. And I had really cool techniques I'd work with patients on, and over the course of time, the more they practice these techniques, the pain started to go down without me aggressively treating the acute pain. It was amazing. And here's an example of a lovely woman who had this experience. And she wrote this about us. When I first came to see her office, I was suffering from severe chronic migraines to the point where I could not leave my house for months. I had tried every medication and procedure imaginable for migraines, but nothing helped until she reviewed my overall health and treated me not just for my head, but for my mind, gut, and body. She truly cares about her patients. She constantly checks in and listens to your problems and offers advice about changing your health and lifestyle. Becoming aware of and treating my mind and body's needs has helped me achieve a healthier life while reducing my total number of migraines. I would not have been able to do that without her combination of Eastern and Western medicine, as well as her thoughtful advice. Caitlin. Oh, thank you, sweet Caitlin. What was amazing about this case is I still remember her father coming in to see us. He actually walked into our front office. He walked into the apothecary. He grabbed one of our most popular nutrient blends, and he came over, and I happened to be at the front desk, and he said, "Hey, my daughter's having severe headaches. Can I just give this to her? Will this help her headaches?" And I remember thinking, I said, can I ask you a favor? Could you bring her in to see me? Because I think there's going to be more to this than just taking some nutrients. And quite honestly, her main thing we worked on was focusing on the in-between, focusing on strengthening her mind. And to this day, she's doing so well. I'm so proud of her. The next shift is understanding that migraine is a gateway disease. Well, what is a gateway? A gateway is something that serves as an entrance. Okay? So when the migraine starts, it's kind of giving you an entrance into an understanding of yourself. Migraine, we know, is the most disabling neurological disease, okay? But is it risky to have them? I questioned that early on. I thought, I allowed myself to believe that if I did a good job of stopping the pain, my job was done. The patient experienced freedom from pain with the medicine, so that was enough, wasn't it? Well, I noticed something, and hindsight's 2020. I've been practicing 15 years, so I started noticing there was a group of patients that I called the unresolved migraine group. They stayed the same over the years. They kept getting the same number of triptans every month, or maybe they even worsened over time, okay? What I noticed with that group as I observed them is that many of them started experiencing digestive issues, sleep disturbances, joint pain, mood issues, autoimmune diseases, and yes, my friends, even cancer. The other group, the patients whose headaches were actually improving over time, were not experiencing these secondary side effects or these secondary conditions. And I thought, was there a connection here? Was there a connection? Well, then studies started coming out. This study was really interesting. It looked at migraine patients and found that migraine patients were at increased risk of heart disease. Now, if migraine is linked to an increased risk of heart disease, maybe that migraine pain is a warning that you've got some risk factors you need to look into. Maybe your blood pressure is high. Maybe your cholesterol is off. Maybe you're too inflamed. That migraine was your outward warning. It was that gateway. It was letting you know there was something going on the inside, and you had to pay attention to it, not just ignore it. Then there was another study that was really concerning. Look at this. Frequent migraines can lead to changes in your brain. Did you hear me? Frequent migraine can lead to change in your brain. That is a little scary because the studies were showing that there was little white matter lesions, brain lesions with those that had frequent migraines, especially with aura. And they found that those brains, the migraine brains, were shrinking. They were getting smaller, more atrophic over time. Certain key areas of the brain were shrinking. Now, this really concerned me because I started thinking, well, wait a second, then migraine isn't just a headache. This is something really severe. And if migraine patients were actually having brains that were changing over time, they could potentially have problems with focusing, concentration, cognitive issues, and mood issues. And we know that 25% of people with migraine suffer from depression and 50% suffer from anxiety. So if having all these headaches can lead to changes, structural changes, and mood issues and heart issues are a warning. I mean, this is a warning that there's something going on in your system. And migraine is that gateway. It's allowing you to enter into your system to understand there's something not in harmony. So when I was in med school, as I graduated, I took an oath, the Hippocratic Oath. First, do no harm. Okay? And I started realizing as I was practicing, migraine can actually lead to other diseases. Migraine is risky. Pain medications may have decreased the symptoms, but did not address the root cause. They allowed one to feel better, but not necessarily be better. Migraine is expensive, costing around $9,000 per year. So it's not just that it's risky, it's costly, my friends. $9,000 a year. And you may be saying, well, my insurance covers it. It's okay. But at the end of the day, this is a costly disease. And what if the migraines worsen? What if the meds stop working? What's going to happen then? And when we think of costs, how about the cost of missing time with your loved ones? I talk to so many people that lose out on days every month. They can't go to events. They can't be with their family. They just can't enjoy their lives because of the migraines. I asked someone, what is the price tag on that of not being with your kids? And she said, infinite. It's priceless. I can't put a price on that. So pain is a warning. If you do not listen to it, pain signals continue to get louder over time. You're at risk of migraines becoming stronger. Medications may stop working. Injections and procedures may be needed, which can be costly and painful. Possibly new conditions may arise. Listen, everybody, you can't ignore it, okay? It's a divine messenger guiding you to get reconnected with yourself. Why are you ignoring the message? And is this the story you want of your life? Is this your story? I hope not. If you actually listen to your pain, you can shift your story. Pain intensity and frequency can reduce over time. Sleep will improve. Daytime energy will increase because your circadian rhythm will be better. Reduce medicines and injections. That's what will happen if you listen to your pain. You will feel less stressed. You'll feel happier, more abundant. Your fear and worry will dissolve away as the migraines dissipate. Your risk of other diseases may improve. And what is the solution? Well, I'm going to tell you the solution is prevention and reconnection with yourself, with who you are and why these migraines came on in the first place. Ayurveda, which is this ancient, beautiful 5,000-year-old science, really teaches you these concepts. And that's why I've spent 25 years studying this science, because I can tell you it is a beautiful way to understand why you're having your pain. And I remember a lovely woman named Grace came in and she worked with me. And at the end of her work with me, she said this, quote, "The Ayurvedic supplement and approach helped my overall system. My stomach improved, panic attacks reduced, less constipation, and migraines were better." Thank you, Grace. It's amazing to hear these outcomes because this is kind of what I hear all the time when people do the work. It's beautiful. All right, I'm going to give you guys my secret weapon. We're on shift number 3. My secret weapon. Migraine is more than a brain problem. Now, this to me was hard. Okay, everyone, I'm a neurologist, and I wanted to believe that migraine was a brain problem, right? Because that's what I studied. And I did all those, things that you're supposed to do. When I came out of my training, I started quieting down the brain using medications, seizure medications, antidepressants, beta blockers to quiet the brain. It led to short-term relief, but let's just be honest here. They masked the root problem. The pain didn't really start in your brain, okay? Your brain's affected, but it didn't start there. And the medications led to some side effects. Just like the short-acting meds, so do the long-acting ones. Cognitive issues, weight gain, fatigue. Over and over, I'd have patients that were getting better with their pain, but then they get these other secondary effects. And then we thought, what is better? The medicine side effect, is it outweighed by the pain relief? And so the meds may serve as a bridge, but it's up to you to search for the why. And I want you to ask yourself, what is your head trying to tell you? Are you able to hear it if you're on a medicine? I remember there was one woman who came in early on and, she was telling me about her hormones. I said, how are your hormones? She's like, oh, they're great. I have cycles that are exactly every 28 days and they last 3 days and I don't have any cramps and I don't have any headaches with my cycles. I said, oh, perfect. And then I looked at her med list and I found that she was on a birth control pill. And I said, well, wait a second. You didn't tell me you're on a birth control pill. She said, yeah, I'm on a birth control pill. I said, well, then your hormones, let me ask you, how are your hormones when you're off of the birth control pill? She said, oh, well, they're horrible. I've got severe cramping. My cycles are irregular. I've got horrible migraines. I get PMS. I have horrible sleep issues. I said, oh, my goodness. Well, then I want to know who you are without your medication. Okay, please, everyone, hear me on this. I understand. I do, in my clinical practice, prescribe medicines. But I'm going to tell you, you can use medications as a bridge. I'm okay with using them as a bridge, of course. But when you start to become, kind of reliant on the medicine, when you become enabled by the medicine, when you don't even know who you are anymore because you're medicated, well, that's a problem because you lose touch with your authentic self. You lose touch with that inner voice that's trying to keep you connected. I knew there's another way to understand pain. And then lo and behold, early in my second, third year of practice, my daughter started struggling with migraines. Okay? Around this time, I started journeying into other approaches. And I remember one of the first conferences I went to was this beautiful conference run by two MDs and very bright MDs. And it was a nutritional medicine conference. And the nice gentleman sitting next to me asked me, he said, hey, what do you do? And I said, oh, I'm a neurologist. I specialize in migraines. And he started laughing. And I said, why are you laughing? Migraine is serious. This is really disabling. He's like, no, I'm not laughing about the condition. I'm laughing because you said you specialize in migraines. I said, yeah, I just see migraine patients. I specialize in migraines. He said, no, you can't specialize in migraines. Migraine is a disorder of many systems gone wrong. I said, what? And then at that time, I started hearing about food allergy testing. So I started testing my patients. One of them was with my daughter. I started testing. There was this beautiful study that had come out in 1985 by Mansfield that showed 43 adults with migraine. They put 13 of them on an elimination diet, okay? What they found was there was a 66% or greater reduction in the headache frequency in that group. 5 out of 7 patients provoked migraine when the food was reintroduced. So, hey, there was a gut link to the head. As that nice gentleman said at that meeting, migraine is a systems disorder. Imbalance in your body leads to head pain. And then I began formally studying Ayurvedic medicine and functional medicine to determine the root cause of disease. And I'm happy to say by using this approach for my daughter at age 5, when she started getting headaches, she is now 15 and been headache-free. So what does Eastern medicine tell us? Well, this is the cool thing about Eastern medicine. We are all connected. We're all very similar in a certain way because we're all born with these 5 elements: air, space, fire, earth, and water. Okay? Those of us that have a little bit more of the air and space elements to our nature are more of what we call the Vata types. Those that have more fire and water are more the Pitta, fire types. Those that have more earth and water elements to our nature at birth are more the Kapha types. And this is called your dosha, your mind-body type. What happens is if you collect too much wind energy, you can start getting a Vata excess. Okay, and that can lead to pain. That's like a tension headache. Pain in the occipital, back of the head, in the neck, tight neck. Maybe you have more left-sided symptoms. You can get noise sensitive. If you build up fire energy, and you could be born as a wind person, a Vata person, but kind of do fiery things. And this increases fire energy in your body. It presents with temple pain, behind the eye or brow pain, moderate to severe in intensity. This is your classic migraine, where you get light sensitive nausea. And a lot of people that have fire have right-sided symptoms. If you have a lot of earth energy, and what can give you a lot of earth? Well, eating a lot of cheese can be really earthy because it's an earthy substance. You can start getting frontal headaches. You feel congested. Maybe the pain is there, but it's mild to moderate, worsening with bending forward. So depending on your energy, you can start getting different kinds of headaches. This was fascinating to me. And I started looking at headache a different way. Now, I knew that all those green arrows or triggers activated, my patients. The weather, shifts in hormones, stress, certain foods. You don't have to learn the anatomy here, but number one's the hypothalamus. I call her the divine mother, the divine internal guide. When she's like, too much is happening, there are too many activators, what she does is she sends an alert signal to your brain and says, oh my goodness, I am concerned with the well-being of this individual, so I'm going to send an alert signal to the brain. And number 2 is that brainstem that gets activated. Number 3 are the nerve endings that get inflamed, and boom, the migraine comes on. It's a warning, right? Well, the same thing's happening at your gut, just so you know. Just like your brain can get excitable, well, let's just imagine your gut is under stress. Maybe you are eating lunch during a really intense business meeting, okay? Now, just think about this. If you're eating lunch when you're, maybe being yelled at or something really intense is being discussed, what happens is your blood flow is going to shift. This is just a natural response. Your blood flow will shift from your gut to your muscles because your brain is thinking, I need to run from the bear. Well, it's not, there's no bear in the room, but there's a stressful conversation that's happening. So your gut gets excitable. What happens? You don't make enough digestive enzymes. You don't make enough hydrochloric acid. You start to get food intolerances that we talked about. Well, when you get food intolerances, you eat those foods over and over, you start to get a decrease in healthy bacteria. What do you start doing? Well, you start pulling out the gluten out of your diet. You start taking probiotics. Maybe you take a little, glutamine, which will help the mucosal layer because you're starting to develop leaky gut syndrome, which we all talk about. It's not that I don't use those things in my clinic. Yes, I do believe that we have to monitor, maybe take some foods out, replenish bacteria, maybe work on the mucosal layer. But what Ayurveda teaches us is work on the system, strengthen your gut, bring your gut to a less excitable state, and that will improve your condition. So the old way was this. Okay, oh my goodness. Way back in the day, I'm thinking how long ago this was. I used to use an abortive medicine and try to get rid of the pain. And if that didn't work, I'd use more of that medicine. The Maxalt didn't work for the attack, I'd add like an anti-inflammatory, an Advil or a Vicodin to it. And if you started getting a lot more headaches, I might have put you on a preventative medicine, like a Topamax or, an antidepressant like Zoloft or something. And then I'd give you a migraine diet and say, avoid the MSG, avoid these things that'll activate your system. And then I tell you to go work out. Okay? The new way, which is to me far more profound and it's an amazing model, is to work at the root cause. I would say, hey, let's look at your digestion. How is your digestion working? What's stressing your digestion out? How can we improve it? How is your mind? Let's work on your mind a little bit. How are the hormones? How can we balance those out? How do we not let your body go into overdrive with cortisol production and stress? How about detoxification? Do we need to cleanse out your physical body? Because if you're not breaking down your foods well, I'm going to tell you, your liver is probably a little toxic. Your fat cells hold a lot of toxins. So let's do a little cleansing, a little detoxification. This is the new way of managing migraine. And you can see I didn't even touch the brain. I'm working on the system. So what if you continue to ignore your signals? Well, migraines can worsen. They can get louder and more intense. Associated symptoms like nausea, vomiting can get worsened. You can get more sensitivities. I've seen that over time. You may even develop new sensitivities. Costs, I'm sorry, but the costs are just going to go up because as you can imagine, when you start to develop more and more pain, you can get in a situation where the meds stop working, you need stronger medications or injections, and new symptoms may arise and new conditions may arise. And what if instead you said, I'm going to start addressing the root cause? Well, the migraines would improve along with other conditions. You would feel more balanced, mind, body, and spirit as you felt more in alignment. Your visits to doctors would go down as you would use medications less and less injectables and less procedures just because your body is more in alignment. It's really straightforward. What is the solution? Well, I'll give you an example. One little example, a little take-home pearl you can use today. These are some of the things that I do to kind of help the excitable system, to kind of balance out the system. One of the principles is chew your food. And I know that may sound so simple, but let me just go into this for a second. Now imagine you have this food you're eating and you only chew 6 to 12 times per bite, okay? Versus what you're supposed to do is chew at least, 32 times. Well, I know that's hard, but 25 to 30 times or so. Well, if you're not chewing your food well, what happens is you don't make enough salivary amylase. Amylase breaks down the carbohydrates, breaks down that food. So then it's prepared and it's ready to enter your upper digestive system. If you don't chew enough, the food enters and it isn't really broken down that well, and the brain hasn't had a chance to have a conversation with your stomach to say, hey, release some stomach acid. Because the food entered so quickly, because you didn't chew it well, it enters so quickly into your upper digestive system, your pancreas may not have enough time to make pancreatic enzymes. Your bile may not have been signaled by the brain to be released from the gallbladder. So what ends up happening, if you don't chew enough, it's a really simple principle, you can start getting food intolerances because you're not making enough acid, enough bile, enough enzymes. And the brain didn't get enough time to process that food was making its way down to the upper part of the gut. So chewing, something as simple as chewing, can relax the gut. And they did a study on Japanese fast eaters and slow eaters, and they found that the rapid eaters had like obesity rates of like 41% in their group, whereas the really slow eaters, their obesity rate was in the 22% range. So what can happen is simply by chewing your food, you can actually have less risk of weight gain because the food doesn't become intolerant and your gut is more relaxed. Another simple little trick is having lemon water in the morning. This is just a simple thing. I do it every single morning. Take a nice glass of warm water, put it by your bed, squeeze half a lemon in there. In the morning, drink that full glass. Lemon is alkalinizing, and when you're alkaline, you're less acidic, less likely to produce inflammatory peptides. Lemon cleanses out your liver. And when you hydrate first thing in the morning, you're flushing out the toxins that your liver was clearing the night before, and you can have a better bowel movement. It's an amazing little trick that does wonders for you, for your gut and your lymphatics. Observe what you're taking in. Both food and medication-wise. Are you eating a lot of the same thing over and over again? Because you could potentially have an intolerance to that food. And, potentially, if you don't rotate your foods, you can get used to it and have problems with that item. What are you taking in medication-wise? Are you taking in a lot of Tylenol, over-the-counters? Are you drinking a lot of coffee, having a lot of caffeine? This can all create impairment to your system, so please pay attention to that. This lovely woman, Debbie, she wrote this really sweet testimonial I want to share with you. She said about 10 years ago, she, referring to me, started talking about the gut way before the gut was a thing. Anyway, this sent me on a path that would forever change the frequency of my chronic daily headaches, which are now close to none. Taught me that what I put in my body affects my entire being. I appreciate everything she has done for me and see her more as a teacher. Let's face it, her positivity makes you feel like you can and you will get better. Thank you, Debbie. What's so interesting is one of the reasons I'm so positive is because this ancient model works, because these 5 shifts work. I did this on myself. I've used them for years to keep myself healthy, for my family, for my friends, and my patients. And I just stay positive because I just know if people will follow the shifts, they'll get better. They'll get better. Quick recap. So shift 1 is stop focusing on your pain. Shift 2, migraine is a gateway disease. Shift 3, migraine's more than a brain problem. Now let's discuss the 4th shift. Be responsible for the signal. Did you know that 75 to 90% of physician visits to primary care doctors are due to stress-related problems? Yes, that is a sad but true fact. Migraine pain arises when we are not in alignment with ourselves. Each of us manifests stress in a very unique way. Unique stress type dictates how we present with pain, and ancient Ayurvedic medicine, which is 5,000 years old, tells us that we can fall into one of 3 specific pain types. The model is actually templated to help you understand that, so you don't have to reinvent the wheel here. The goal is to delve into that stressed, imbalanced self and understand specifically what triggers it. This is how you can get to know your triggers, my friends. Are you with me here? So if you can understand your stress type, you understand your pain type, you can understand your triggers because it's already templated. Exactly what to do is templated in ancient science. We need to be responsible for our pain and have ownership over our pain and what the message is. This is where you need to be responsible, okay? Because if you can start to own your pain, understand your pain, and actually start to connect with it, you can understand the message. Most people, when they're in pain, they disconnect. And I don't blame you. The pain is painful, so you want to just take a pill and go to sleep, right? But I'm going to tell you something. What I'd prefer you do, not that I want you to be best friends with your pain, But I want you to connect with it. Like just understand it. Kind of understand what it's trying to tell you. It's got a language there. First and most important step is just to kind of connect and to step into it a little bit so you can relieve it. Once we awaken and we become aware of our pain body, we can actually start to fully embrace what we need to reduce our burden of pain. Back to the 5 elements. We have these 5 elements. When they get out of balance, they create physical symptoms. So let's just say you are the Vata type person, air and space element. We call you the wind type, moving, going, doing all the time. Well, unfortunately, too much wind in your head can make you anxious. Too much wind in your gut can create gas, bloating, and the wind goes into spasm state, so you get neck pain and constipation. Well, what does this do to your circadian pattern here? Well, you don't have to get into too much of the detail of the picture here, but keep in mind that we have this beautiful hypothalamus, that divine messenger that's kind of trying to keep our system in balance. And so when we wake up in the morning, the hypothalamus chit-chats with the adrenals and makes some cortisol, those little green dots on the bottom right side. And the cortisol is that natural hormone that gives us energy and helps us wake up and helps us kind of go on with our day. And it's that natural rhythm that gets us up and moving. Well, let's just say you wake up and you've had some stress, and the stress is coming from because the night before, maybe you got home from work late, you took on too much at work, you had a late dinner, so you had a heavy meal late at night, you didn't sleep very well, you were a little dehydrated the day before, and you had a headache when you first woke up in the morning. So that's a stress signal. Your hypothalamus is saying, oh no, she's in danger or he's in danger because you haven't been nourishing yourself. So the hypothalamus tells the adrenal glands, hey, let's make some more cortisol. And what the hypothalamus is doing is giving you the headache to let you know that you're depleted. Okay? Well, what you're supposed to do is make sure the next day you replete yourself. You take care of yourself. And then you wake up the next morning with a beautiful, normal circadian rhythm. Unfortunately, what I've seen happen, I know many of us have done this, is that we continue to stay in that stressed state. So back to the example of taking on a work project, maybe you continue to stay up late every night. You continue to stay dehydrated and not eat your meals on time. You have late dinners. You don't get enough sleep. You keep waking up every morning with the headache. What happens is your body tries to help you. The hypothalamus says, okay, adrenals, let's pump out some more cortisol. She's having a lot or he's having a lot of stress. And in addition, you're having a lot of head pain because that is your signal that you're not in harmony. So what the hypothalamus is doing is actually giving you the headache. Yeah, it's also helping you by making some cortisol, but it's giving you the headache to say, I'm letting you know I'm concerned about your well-being. Now, what you can see up in the top right, desensitized. What happens is the hypothalamus, when you stay in that state for a very long time, it starts to get desensitized. And eventually the hypothalamus says, you know what? Because you're not listening to this signal of pain, the hypothalamus drops out. The adrenals drop in their cortisol production because they just can't maintain that high level of production. The hypothalamus turned on the adrenals to deal with the acute stress. But as the stress continued, and because you didn't shift, what happens is the hypothalamus takes a back seat. It gets desensitized and the adrenals drop out. Does this make sense, everybody? So your natural rhythm is there to protect you. When you have a stressor, the hypothalamus, the divine mom, kind of says, okay, I'm going to take care of you. I'm going to give you a little pain to let you know you're out of balance, but I'm also going to pump out some extra cortisol to deal with the stress. But I want you to go back to your natural state again. I want you to take care of yourself and not overdo it so the pain will go away and you will go back into rhythm. But if you keep ignoring that message and you keep allowing the self to have pain, or you use things like over-the-counters or prescriptions or injections to get rid of the pain and not hear what the message is, which is to rekindle, which is to reset, which is to nourish yourself, then what happens is the hypothalamus gets a little pissed off. It's like the mom that's telling the kid to clean the room and keeps on telling the kid to clean the room. And you know, the child says, okay, I'm not going to clean the room. And the mom says, fine, then keep the room a mess. I don't care. You know, she gets a little pissed off, takes a back seat. And what ends up happening is that over time, the system gets disconnected. The hypothalamus loses connection with the adrenals drop out in cortisol production, and this is the challenge when this happens, when this disconnect happens, which I've tested my patients, and it's pretty much every migraineur I see has this challenge. They're disconnected in their circadian pattern. What happens is that disconnected state, when the hypothalamus isn't in charge anymore because you haven't been listening, you start to develop secondary symptoms. That's when you get the digestive symptoms. That's when the headaches worsen. That's when you get the secondary conditions like joint pain and autoimmune conditions. And unfortunately, it can go down the path to strokes and heart attacks and all these different things because you're not connected anymore to yourself. And unfortunately, that's where things like weight gain can happen because the adrenals are running on autopilot. The blood sugars are going up and down. There's just no regulation of your system anymore. So I'm here to tell you that the key is to understand your circadian rhythm needs to be balanced. And the beauty is that ancient medicine offers you a system to understand this. Here's an example of a lovely, lovely patient who went through this exact situation. She said in a testimonial she wrote about our clinic, "I had extreme stress at work with late nights, little sleep, and poor diet. Through her guidance, my guidance, and easy to follow instructions, I was able to transform my entire life in a month. It is in her desire to help each individual patient along with her inherent understanding of the body as a whole that empowered me to rewrite the course of my health." She's one of the most talented and trusted individuals I have had the privilege of working with. She truly believes in the interconnectivity of the mind, the body, and the soul, and looking at these components as a whole to understanding your current state of health. I'm extremely thankful for the ways she and her team have changed not just my health, but also my life. Haley. Thank you, Haley. What a sweet message, but I remember when she came in, she was in that disconnected state. She wasn't responsible for her signal. She wasn't understanding why her symptoms were happening. But once we guided her, we educated her, we trained her, we taught her some techniques of how to rekindle and how to connect with herself. I have to say, she's doing so well and she's feeling so abundant and she's so much more aware of herself that I just know she's going to continue to live an amazing life. And these signals of discomfort and pain won't come back as long as she pays attention. So the last shift, which I find to be very powerful, is investing in mentoring. And, you know, it is challenging because I know that migraine, it does serve a purpose. And you have to keep in mind that migraine is happening not to you, but for you. The pain is there to warn us that we are in danger. We haven't been following the rules, and our brain is letting us know that. Now, the challenge is, even if you understand that it has a purpose and it's happening for you, you may not understand what your rules are that you're supposed to follow. What are the rules that are specific to you? And that's what a mentor can help you do. And I know you understand that migraine is there to remind you that you need to be reset and replenished, and each attack has a message, and that message is to shift the way you are currently living. I just believe you have to have guidance to help you with that shift. Everyone needs a mentor and guidance at some level to go down this path. The cost of managing migraine on your own, well, I've mentioned to you earlier that the average cost is $9,000 a year for migraine. That's medications, doctor's visits, missing work. And how about the risk of worsening of pain? What if it worsens and the meds don't work? Or what if you develop medication tolerance or new diagnoses occur? What's the cost of that? And how about the time lost, not enjoying, with your family, not being present or productive at work, missing opportunities that could occur but aren't occurring because of your pain? Can you put the price tag on that? I have personally spent thousands of dollars and countless hours to learn this model. And I've invested every bit of my being to really understand this model. 25 years of studying it for myself and then getting formally trained and using it in clinical practice. And I want to share it with you because I so believe in it, and it's powerful. It just needs to be distilled down in a way that you can understand it. So today I promised how to reduce the severity and frequency of the headaches without the need for quick fix medications, how to understand your unique pain type, even if right now you feel lost with why you have pain and why it shows up, how to wake up with vibrant energy versus feeling wiped out and fatigued all day. That's linked to your adrenals and your circadian pattern. How to reduce your need for medications and injections and learn to use your mind and body to heal your pain. How to have a balanced, sharp, and focused mind versus feeling stressed and overwhelmed with your life and with your pain. How to banish your pain so you have a deeper relationship with yourself and others rather than trying to hide away and protect yourself in case an attack strikes. How to have less stress and live with less fear of having an attack of pain. And how to have confidence with what exactly triggers your headache pain. This is linked to knowing your pain type and how to manage or reduce those triggers that are unique to you. So what you need to be pain-free, you need to stop focusing on your pain. You need to know that migraine is a gateway disease. Migraine's more than a brain problem. You have to be responsible for that signal and invest in mentoring if you're able. These 5 shifts alone are enough to help you resolve your migraine pain. Now, this is a picture of Machu Picchu, and last year my husband said, we are going to hike to the top of Machu Picchu. We're going to hike for 4 days and get there. And I thought, are you kidding? We're going to hike with our own 2 feet up to Machu Picchu, this ancient city? He said, yeah, we're going to do it. Was I a little nervous? Absolutely. Was I frightened and worried that I wouldn't make it? Yes. But I knew if I got there, it was going to be magical. It was going to be transformative. It was going to be the best thing I ever did. And I did it. I did it. And you know what? It was amazing. It transformed me. It was the best trip I've ever taken. And I'm so happy that I let myself go there, even though I was a little nervous and a little fearful. And now, my friends, I'm giving you a choice to go there. Do you want to go there? You have a choice. I've given you all I can in this webinar, taught you as much as I can. And you have a choice. You can either take this information I gave you and you can forget all about it. Forget everything I said. You can, keep on having severe disabling attacks of migraine, which may even progress or even lead to secondary conditions. You can keep on taking different medications or injections to stop the pain. The cycle of pain may prevent you from enjoying life, spending time with your family, advancing at work. You will keep on struggling to understand why you have pain and how to end these cycles. You will not hear the message from above behind why this pain is happening and what it really means for you. Or, if you want to achieve pain freedom, live life with more energy, improve moods, feeling more connected with yourself, reduce your medications, injectables, and even reduce doctor visits and hospital visits. If you want to improve your overall health, mind, body, and spirit, and get connected with the true meaning of your pain so you can fully resolve it, you have that choice to take. And if you want that, then here's what I have for you. So we have set aside time in the next 48 hours to speak to you personally about how you can apply these ideas to improving your pain starting today. Whatever your biggest challenges are, we have seen it and we know how to overcome it. I've had people fly from all over the country who have really gone to the top headache centers and failed. Find improvement with our approaches because our approaches are novel. I promise you've never tried this before. On the session, we will work with you to craft a step-by-step program to resolve your migraine pain, to get you connected with your stress type, and to discover the root causes of your pain. The cost? It's absolutely free. Absolutely free. But I will tell you, there is a catch. This may not be for everybody. Who this is for those that are determined to make lifestyle shifts, who are open to dietary changes and supplements, who are committed and willing to invest time, who are willing to grow and learn, and lastly, are ready to empower the mind to release the pain. If this sounds like you, book a session now. I would love, love, love to speak with you. And why are we doing this, you may ask? Well, we do this because we love giving back. and helping migraine patients achieve their goals of pain freedom. This is my passion. I love it. I've been practicing 15 years, and now I feel like I'm in service to really share this message with as many people as I know. I love this ancient model, and I really want to bring it in to help you really get to the root cause of why you're suffering. And we do know that some of you might want my help to transform your health. And if so, hey, we can discuss it and see if it's a good fit for both of us. And if not, that's fine too. That's fine too. Like I said, I'm here to serve, and if I can benefit you with this knowledge, that would make me really happy, because I want to share and I want to enlighten you with this information. So please go and set up an appointment with me at Trupti Gokani md.com/apply/ TRUPTIGOKANIMD.com/apply/. Feel free to take a picture of the screen, TruptiGokaniMD.com/apply/. That, if you go right there to that link, it'll take you to my booking, my scheduling page. You can set up a 45-minute call with me, and you'll have a few questions you'll answer just to kind of get a little background, so I have some background on you. And I promise you guys, this will be the most powerful session you've ever had. I've been doing this a long time. I'm passionate about my work. I want to share this knowledge. I want to get you to connect. And it'll be the best call you've ever had. It'll be the best call you'll ever have about the root cause of your migraines. And I want to share a little testimonial with you. You know, I had this patient just recently come in and see me, and she said to me, I can't believe how good I feel. And this is her story. When she was 5, she started getting migraines. And these migraines really, really were powerful. She'd miss 2 to 3 days a month laying in bed because of her migraine attacks. And, you know, she got used to just, you know, not going to work 2 to 3 days a month because of her pain. And when she came in to see me, which was about 6 months ago, we started working on some protocols, and she started feeling better, you know, feeling better within a month or two. And when I just saw her, she said, I want to throw some confetti, because this is the first time since I was 5 years old I have not had to take off days to have to give up my time because of my migraine. She actually went the last 3 months without having to take any days off of work because of her pain. Her pain has improved that much. She has not called in sick. She's been there every day at work, and she loves her job, and she's like, I can be my vibrant self. I can be the best of me because the pain is not getting in the way anymore. And I was so happy, because quite honestly, when she came in, she was feeling a little helpless. She was kind of worried about whether or not I could help her. And when I see someone like her, and she's 35 years old, my friends, so can you imagine that? You know, she's 35 years old. She's been having this headache since she was 5. After 30 years, she's actually able to live and enjoy every day now because of these protocols. So I want you to know this stuff is powerful, and I would love, love, love to help you all. I really would, because like I said, this is my passion. So please go to that link. The spots will fill up soon, because I don't have a lot of open spots, and I'm sure they'll fill quickly. So please grab a spot. I would love to chat with you and just help you on this journey to pain freedom. All right, everyone, thanks for listening in. I appreciate all of you. I'm so grateful and thankful to all of you. Be well, my friends. Namaste. Bye-bye.